Okay, thank you so much. Thank you so much, Emma. I believe you can hear me perfectly. Confirm if you can.
Me, I can hear you. Maybe the volume,
Right.
increase the volume. I don't know, but I can hear you. Okay.
It's on 100%. I'm sharing my screen, so it is even hard to do this. All right. I hope you can see my videos. As we start, let me put my video so that you can attach the name to the face.
Thank you very much.
Yes. So my name is Akankwasa. Right now I'm sitting in a district in Western Nile, a district called Adjumani. So I choose to believe that most of us on this call have heard about Adjumani district, which is located in Western Nile region of the country. And as you can see, it is a little bit hot. And I'm in an environment that has a lot of activities going on, And so you will bear with me when you get a little bit of background noise. We'll try to manage it as we continue with this engagement. Thank you. And
Thank you.
for the bandwidth management, I will be putting off my video, but I will keep with us using the audio. Thank you so much. I'm excited to hear from all of us. And most importantly, I'm excited for the opportunity to be able to share with us. I know that most of us already with the available materials online and with the experiences ever since mostly after COVID-19, when we started engaging in remote work and enhancing more on digital work environments. I believe we have some information on the topic we are going to discuss today. But nevertheless, learning never stops. And every day we get to learn something new. So yes, gear yourselves up and let's have this discussion. Like Emma said, let it be interactive. I know that already this is an example of remote engagement because having virtual meetings most of the times allow us to stay a little distracted. But I will try to ensure that we are engaged and we don't get more distracted. So our topic for today, I'm going to begin my presentation by asking us just one simple question. We can put our ideas in the chat box so that we get to know how we are doing. Okay? So my question is, what have you heard about mental health? You as the gentleman, we didn't do an introduction, so you'll forgive me. I'll keep trying to look at the names in the chat room and on call to try to relate with the people that are in this activity. So what have you heard about mental health? Or when someone says mental health, what comes to your mind? So as we start this engagement, keep that at the back of your mind. Like, what do you know about mental health? Or what have you heard about it? Before we take it into the details of mental health in remote and digital work environments. Okay, so Emma, you'll support me to control the chat and whatever they drop in there, please, you let me know. So about my question as we begin, an icebreaker, what have we heard about mental health? Has anyone tried to attempt? Yes.
Yes, Rita says low stress levels.
Okay.
Dennis just said yes, he has. Maybe he's going to get more details today.
Okay.
Please keep the chat moving. I'll let you as the chat comes in. I'll be letting you.
Sure thing. That's great. Thank you, Rita. Thank you, Moses. And yes, what Rita said, mental health being low stress levels, yes, that is mental health. So there is a slim line and a little bit of confusion differentiating between mental health and mental illness. So most of the times we mix the two. We say mental health when we are meaning mental illness or what we call mental issues. All right. So this is going to be our presentation guideline. And as I discuss with us, this is what we are going to engage in today. Definition of mental health, understanding mental health in remote and work environment, and then psychological effects of remote work. Okay. Then the contributing factors of mental health challenges in remote work. Then the practical strategies for prevention and balance. And as I move on to my next slide, okay, how many of us on call? Like I said, this is already an example of remote engagement, what we call the virtual meetings, But I would like to hear from us. How many of us who can say that the 80% of their work or their engagements are in a remote setting. You know, you do your work using remote methodology. You do your work using a lot of digital appliances. You can show the hands, or you can type a yes or me something in the chat to show that 80% of your work, you do it remotely, or you do your work in a digitalized environment. Emma, do you? Yes, I choose to believe that smile is for a yes, because by the time you're the organizer of the webinars, it means you do a lot of interactions with people virtually, which makes you do a lot of remote engagements.
Yes,
Okay?
that is true. Yes.
Yes. So my question is here, what I was asking and what Rita and the friend attempted. What do you know about mental health? You know?
Alinda
So the
Masi
picture on
says
the
Alinda Masi says it is like a disorder
okay.
one gets that affects the brain.
Okay. So you see, Alinda is attempting mental illness instead of mental health. So that's why I said there is some confusion between mental health and mental illness. Yes, please.
Then in Congo says it is it relates to a person's emotions and may work in both places, something like that.
Interesting.
It refers to someone's emotions, something like that.
Interesting. You know why it is very interesting is that all the attempts you're giving are correct, and all attempts you're giving shows that you're picking from your own understanding. You've not gone online, you've not picked Google. So that means it is a great, interesting feeling to know that people are using their own understanding of mental health, which is a good start. So let's see what mental health is all about, okay? And then we can try to double check with what we've been knowing previously. That's why we say education is moving from known to unknown every day. So mental health is about how we feel and think on the inside, okay? And how well we handle the ups and downs of life. So if you know that you can ably, competently, strongly manage and handle the ups and downs of life, you know, your mental health is well. So there we say you have mental health. How you feel on the inside, how you think. If you think positively about life, if you're this person who has positive coping strategies with the different stressors of life, that is mental health. So it is the ability to manage the stressors and the challenges of life and ably be able to continue working strongly on all the life challenges that you encounter. So that's when we say that you have mental health. You don't give up. You don't say that today my boss has, turned out the request I needed. Now I'm stressed for 2 days and I don't want to go back to work. Or I lost my uncle and now I've lost all the interest in my relatives. You understand? So being able to feel good on the inside, being able to handle the ups and downs of life, that's when we can say that someone's mental health is in a good state. Okay, so when I ask you a question of how is your mental health, when you're feeling well on the inside, when you're strong and able to wake up or to get out of your bed, then there you can say that my mental health is well. But then there is another animal called mental well-being, which adds on to mental health. So mental well-being is feeling good in our daily lives and promoting our positive behaviors and emotions. That is mental well-being. Feeling good in your daily life, whatever you're doing, feeling good about the job you're doing, feeling good working in the environment you're in, there we say your mental well-being, and then having positive behaviors and emotions. Okay, we'll get more to learn about behaviors and emotions as we continue. Now, let's see on another confuser of mental health and mental illness. So when we say mental health, it is a big whole topic. But under mental health, what we confuse most is that it is different from mental illness. And most of the times we use mental health trying to mean mental illness. So mental illness is a condition that affects a person's thinking, feelings, or behavior, leading to distress or difficulty functioning in a daily life. Okay? So where you say that I have negative emotions, I'm feeling down, today I'm feeling low, I'm feeling stressed, I'm depressed, I'm feeling anxious, and you're not able to function normally in a daily life, then there we say you have a mental illness. It could be a short-term stress, it could be a short-term depression, but anything that can disable you from functioning normally, that can lead to behaviors of distress, that can lead to behaviors of low mood, that is mental illness, which I know that most of the times we confuse it with other mental disorders that are related to that lead to mental illness that we usually term as mental illness. We'll see about them. And now this is the statistic that I want to bring to us as we get into this engagement. Did we know that 1 in 10 people in Uganda, 1 in 10, so wherever you are, if you're at home, you can count the family members around you, but just know 1 in 10 people in Uganda has a mental health problem. Okay? A mental health problem, which is under the mental health, the mental illness. Okay? Then 1 in 7 people across the globe lives with a mental disorder. 1 in 7 people live with a mental disorder. We will get to know what are those. Then Uganda State Population Report 2025. I know most of us must have read that report. Okay, it declared mental health as a silent emergency. So meaning that is one sector that I must appreciate YMCA for picking interest and saying that let us empower people, let us create awareness about mental health, especially in the remote and digital working environment, because people are going through a lot and it is a silent emergency that if you don't manage it, it will lead to the statistics we are seeing here. An estimate of 24.2% adults, 22.9% children are affected with mental health. That is from the Population Report 2025. You can get in details of that and get to understand what was the cause. Then the 2022 WHO Mental Health Report indicated that 15% working age adults live with a mental disorder. Why am I giving us all this background? I choose to believe, Emma, that the people on call are people who are engaged in working in hybrid lifestyle. So you might find that sometimes you're working from home, which is remote work, or other times you're working from office, okay? And at the same time as you're working from office, you're in a digitalized environment. You have the computer, you have the phones, you have the tablets. Literally, you're all around technology, okay? Then in the first year of COVID-19 pandemic, global prevalence of anxiety and depression increased by a massive 25 to 30%, adding to the 2022 results. So imagine moving from a statistic globally of 25 to 30 after COVID, and that's when remote work became a new normal. Working from home became a new normal. So the people that reported mental health challenges, the percentage, WHO, after doing an analysis and assessment, we increased it from 25% of people who were affected to 30%. And that is of then. So on the side here, there is a well-being wheel. Okay, how do you measure that your mental well-being is okay? You look at your emotional well-being, you look at your financial well-being, you look at your environment, you look at your intellectual, your occupational life, your physical life, your social life, and your spiritual life. Okay? Emma, you'll continue looking in the chat. In case someone needs me to pause and respond to something, please do not hesitate to drop it in the chat. So now let's look at examples of mental. No, let me first go back here. Yes, at this point, do we know some examples of mental disorders, or have we had some examples of mental disorders that we can quickly drop in the chat? Or what are some of the mental illnesses or mental disorders or mental issues we have had in our environments, or we have learned about, or we have observed? Anyone? Emma, has anyone dropped anything in the chat? Mental disorders that we have, we are aware about. Linda, you're unmuted. Okay. Like I said, I can't get to the chat, but let me continue and give us examples of mental disorders or mental health disorders. There is this common one called anxiety. If this wasn't a virtual engagement, I would see by show of hands or by sharing experience how many people have heard about the disorder called anxiety, or how many people have experienced anxiety or have been anxious at a certain point in life. And what are, Yes. Another disorder, mental health disorder, is called depression. Yes, Alinda, your hand is up. Okay, let me continue. Alinda, your hand is up.
Yeah, I just want to talk about that I once expressed about the anxiety part.
Mm-hmm.
Yes, and I also want to talk about the depression part.
Yes, please.
Yes, depression part is all about like imagination. These women, these days when your first time producing, because you've never been a mother before, there's that feeling you feel depressed, you feel like what you used to do, you're no more doing it, you're feeling something new into your life. Okay, that experience.
Mm.
Yes, that's what I want to talk about.
Yeah, thank you so much. So I would ask a leading question to that. When you feel so down, you feel depressed and everything, what are some of the signs and symptoms that you can tell that this person is experiencing anxiety or depression? Anyone, not only Marcia, Linda, but anyone. Signs and symptoms that you can say, my colleague or my friend or my classmate is depressed or is going through anxiety, is being anxious. Anyone? Yes. Okay. We are not going to dwell on it, but anxiety, to just bring us to speed. I don't know if you've ever been invited for interviews, and then before they call you in at the panel, if all of us are to explain or share our experiences, that can give you now what it means to be anxious. Okay? So that is one scenario or where you can tell that someone is experiencing anxiety. And unfortunately, when such signs and symptoms go on for long, that's what leads into depression. So if someone is you're seeing low mood in a person, they are isolating, they are withdrawn, they are talking about having headaches, they are losing sleep. You get what I'm saying? Those are all signs of anxiety. But when they stay on for more than 2 weeks, they lead into what we call depression. That's when you find someone doesn't want to get out of the house, someone loses appetite or starts eating too much, someone gets suicidal ideas. There you get to know someone is really depressed. Okay? And that is the point when you have to seek medical or therapy or professional support. Okay? So we have another condition called bipolar. Okay, so bipolar is related with the mind, people who have mood disorders. Okay, and then we have what we call schizophrenia. That is also a disorder that comes with hallucinations, a disorder with long-term mental illnesses that disrupt someone's thinking, emotion, and behavior. Okay, then we have autism spectrum. In Uganda, you've seen they have started even associations of parents with children who are suffering from autism. So autism is a mental health disorder. Alinda, is that an old hand or a new hand?
So it's an old hand.
It's okay, cool. Yes, then we have what we call conduct disorder. For people who are in a work environment, you find that someone's conduct, the way they behave, the way they take themselves is not okay, They are either hyperreactive, their conduct, they don't take care of themselves, they don't care about their environment. So that is also another disorder Rita, am I seeing a hand up?
Yes, Leah, I wanted to ask.
Yes,
For
please.
example, if I'm taking back to the mental well-being wheel, the first wheel that you displayed.
Yes, please.
Exactly. Emotional, financial. So my concern is on financial. There are certain days or even those stressing moments where you don't have 100 and you're really anxious. So at what point do I have to go to, at what point do I seek medical health?
Okay. So when let's say your
For me to be able to
finances.
know that, okay, I think now this is a mental health.
Yes. So mental health issues or mental health challenges are caused by different sectors in life. So finances is one of them. So like scenario you've given that, for example, if you have days when you don't have money, you'll find that the disorder you're having is basically anxiety, okay, which can be treated by you picking up on positive coping mechanisms like doing relaxation exercises or finding strategies that can help you outgo it. But if having no money, because some of the root causes for mental health issues is like poverty, where someone extremely has no money for a long period of time. Okay, so that one can send them into depression, where you find someone is isolating, is antisocial. But this one, like let's say I use your example, Rita, if you're a working person and your salary delays, and for some days you're lacking money, but once you receive the money, all those signs and symptoms of withdrawal, of not wanting to be in people, not wanting to talk, you find that they disappear. There you don't need to seek for professional support. You can manage it by the different coping mechanisms and the different strategies that I will be sharing with us in the coming slides. So that one can be managed. But if those signs, if that sector or if that well-being or that kind of lifestyle causes you to be, for example, isolated for more than 2 weeks, or it causes you to dislike people, or it causes you to be withdrawn in work more than 2 weeks. So long as you are experiencing a symptom for more than 2 weeks, then there you need professional support. You can reach out to a counselor, you can reach out to a peer supporter so that you can overcome it. Okay? Yes. Thank you, Rita. And Alinda, your hand is an old one, right?
Yes, it's an old one.
Cool. All right. So yes, I was on conduct disorder. We've seen people who really have poor conduct, and that one, don't take it for granted that this person was maybe brought up in a bad home. They didn't teach them manners. It is a disorder. Okay? People who don't care where they are sitting, who don't care how they talk in public, people who don't care how they appear. So that is also a conduct disorder. Okay? Then attention deficient hyperreactive disorder, where you find that in a workplace where you keep saying this person is an attention seeker. So there is nothing like attention seeker. Attention deficient hyperreactive, that is a mental health condition. Then stress and trauma. Okay, like I said, if this was if a one-on-one or physical interaction, this is why I would be asking if you've experienced this. Yes, Victoria, on stress and trauma. Victoria, go for it. Victoria, is it a wrong hand? Nansubuga.
No, it's a right hand. Thank you very much.
Yes, please.
Sorry, I was trying to unmute.
It's well.
So on attention seeker, I want more clarification on that one, on that disorder, because
Yes,
sometimes
please.
you think that people are just seeking attention, but you have said it's a disorder, and so what are the characteristics of those people who have that disorder, and how can they be helped, like in the society where they stay? Because sometimes people become irritated about how they behave, and they think that maybe the problem just the person just has bad manners, seeks attention all the time, so they don't understand them, so they keep on distancing themselves from them. So can you give us the characteristics, and also what can those people in their society do about it so that these people can be helped?
Okay, thank you so much. So attention deficient disorder, which you will commonly hear as ADHD, okay? Those people,
Yes.
you will find that most of the times they are not that lazy, and it's not bad parenting. It is not lack of having knowledge, okay? But you find that a person, every time you're trying to do something, let's say it's a child, they're calling you mommy, mommy, they are grabbing on your skirts, okay? You find that every time if you put them down to sit, they want you to carry them, okay? So most of the times is that you have to seek professional support for them. There are different models and strategies that we use. But as a parent, I'm going to use a child. As a parent at home, what you can do with such people is you have to learn to listen to them, and you have to learn to sit them down and put them in one place and give them eye contact and try to understand what are they seeking, what do they want. Most of the time you find that they fidget with their hands, they tap on the tables. If you have visitors around, they are throwing things at them. So those are some of the characteristics that you asked. Okay, in adults, you find that if it is at work, they are late comers most of the times. There are these people who keep talking. You're trying to call the meeting in order, but they are really not paying attention. Like every time they are off. Okay, so it is most of the times it is related to be a genetic thing that they picked. Okay, it's not that they are taking too much sugar or anything, but what we can do is the same way that I'll give us the strategies for managing the physical disorders. Okay, so there are positive coping strategies that you have to give them. First of all, you have to engage them in therapy, which can be provided by a professional or using the domestic therapy sessions that they can go through. Like sitting with them, you do eye contact and you talk to them. You teach them relaxation exercises. This could be deep breathing or slow breathing, so that before they go out, they are relaxed. Because most of the times what affects them is that they are either irritated by people, being in too many people, or they are irritated by animals, or they are just... So you have to understand what puts them off. Like I said, there are so many different characteristics, but when you understand your own person, what puts them off or what causes them to behave like that, then you learn the coping strategies. So in these strategies, there is relaxation, there is therapy through music, or playing for them like their favorite songs that they listen to, then talking to them, keeping eye contact, among others, okay? But on top of it all, you have to identify a counselor or a professional psychologist who can have a one-on-one with them. Victoria, is that close to being helped? Yes. All right. So moving on.
Yes, thank you. Thank you.
You're welcome. Moving on to stress and trauma. How many of us have experienced trauma? Or how many of us have heard about trauma? I know that at this rate in our country, we use trauma a lot. I'm traumatized. You guys, you don't know what I'm going through. I'm so traumatized. My boss is traumatizing me. You understand? Okay. So what are the signs and symptoms of someone to conclude by saying they're traumatized? Okay. Maybe someone has witnessed a nasty accident on the road, or maybe someone has lost a relative in a nasty way. You understand? Then stress. Stress, this is a short term also. A short-term condition that is caused by different experiences. It could be at work, there is too much work pressure. It could be in school, there is a lot of study pressure. It could be from friends, who are affecting your well-being. So stress is also manifested in different signs and symptoms. But trauma is a long-term one that is from the nasty or terrible things that people witness and go through. If someone has been abused, someone has been defiled or raped, someone has been domestically disrespected, all those can cause trauma. Okay? Yes. So then we have neurodevelopmental disorders. So these ones are from the time of birth. So most of the times, if there are mothers on this call, the moment we give birth to our children, we need to know if people are not mentally impaired. So this is what we call mental impairment, the neurodevelopment disorders. Someone grows, but their brain is not balancing. Okay? And they either... That is when we don't use this word in mental health. We don't call people mad. We don't call people crazy. We say people are mentally impaired. Because today they can be having neurodevelopment disorders. Their speech is not coordinated and everything. But with the treatment, with therapy, they are able to cope with stressors of life. Okay? Yes, Rita. Emma, you see, Emma, you called me for mental health in remote, but the background is very key. Yes, Rita, go for it.
Leah,
maybe before Rita,
yes, please.
I wanted to guide a little bit, because we have around, it's supposed to be like an hour. We have like 30 minutes to go. I would request, if it is okay, for the presenter to present her work, and then we can have the question and answer session later, so that we can be able to move. I don't know if that's fine with the presenter, or we will still want to continue like this.
It is well. It is well.
I was just
believe
guiding,
if we address them, yeah, no problem. Once we are done with this slide, it will be diving into the key topics
It's
on the
okay.
background as well.
Please,
Yeah.
Rita, you can continue. Yeah.
Okay,
Rita?
thank you, Emma and Leah. Leah, my question was on okay, the mental disorders, number 5, autism. So I would like to understand what's that difference between autism and neurodevelopmental disorders? Because I thought autism is an example of a neurodevelopmental disorder.
You're correct, but under the neurodevelopmental disorders, we have autism is one of the examples, but there are other conditions that are beyond autism that are under the neurodevelopmental disorders. So, for example, autism spectrum, it is a condition, yes, under that. But then its treatment is different from other conditions under neurodevelopment that I will share with you the examples for you to get the difference between the two. But you're correct, autism is a neurodevelopment disorder because it is the damage of the nerves, the imbalances in the nerves that causes someone to be like that, to have uncoordinated speech and coordinated movements compared to the normal, or what we term as a normal person. So you're correct that too. The other one is an example of the neurodevelopment disorders plus other conditions that you will get to know later. Okay. Okay.
Thank you.
Yes, you're welcome. Then we have obsessive compulsive disorders. This is where someone has a condition of comparing themselves to others. What they see, they assume everything should be theirs. They compare the way they understand with how others understand. So that is also a disorder that we should look out, especially in a work environment. When you see someone is this person who loves being competitive, not out in a health way, but they are really that people who compare themselves so much. Then we have psychotic. So psychotic, this is where most of us term it as someone is mad or crazy, okay? It is a short-term one that can be treated, but this is when someone really loses control over what happens in their lives. They can be there and they remove their clothes, they walk naked, or they can be there and they lose control of being at their home, they start living on the streets. So that's when we say that someone has psychotic disorders, like the many people you see on the roads that we say are crazy or are mad. So they fall under that category. Okay. Then substance or drug disorder. Okay, this one I know it is very common where we see people, for them to cope up with stressors of life, for them to deal with the anxiety or the depression, they start abusing drugs. It starts as if it is a coping mechanism. They later become addictive and they can't live without it. So that is substance or drug disorder. Then eating disorder. This one also is caused by either depression, anxiety, or stress, where someone either eats too much or eats too little. Okay, that is it. So those are some examples. There are many more. The more we keep engaging about mental health, the more you will get to understand all the different many. So I choose to believe that this brings a light about the difference between mental health and mental health issues or mental illness. Okay? So at a certain point, you can now relate why they say 1 in 10 people in Uganda is battling a mental health issue. Because you imagine, At this moment, someone is already stressed by the session taking long, or someone is already stressed by a report they are supposed to deliver, among others. So that is the background. Good to go? Okay. So now let's get into understanding remote and digital work environments. Like I said, all of us, what we are doing right now is an example of remote engagement. We are virtually having this interaction. So remote work wellness refers to the proactive strategies, practices, individuals and organizations put in place to support the physical, the mental, and emotional well-being of staff who work from home. Okay? So for us to say there is remote work wellness, which is what this webinar is trying to throw light on. Okay, there should be proactive strategies and practices, individuals, you as a remote worker, as a remote employer, or strategies that your organization or your employer has put in place to support the physical, the mental, and the emotional well-being of the staff that is working from home. So remote work is literally working away from the office space. Okay, the components of remote work wellness, they are under physical, health, emotional, social connection, environment, and organizational support. So if you're working from home, for us to say that your remote work, okay, is counted as having remote work wellness, your mental health should be taken care of. Your physical health should be considered. So just because you're working from home, it doesn't mean that when you're feeling sick, you don't go to the hospital. It doesn't mean that you don't set up a workstation. So examples of what we have put around, or it doesn't mean that you lose your social connection. So for you to say that you have a remote work environment, you should have met all these parameters. It should be about your physical health, your emotional health, your social connection, your environment, and organizational support. So what are some of the strategies under remote work wellness? We have setting up a comfortable and ergonomically workstation. So I don't know how many people of us here are under remote work or are under hybrid, so that sometimes maybe 70% you're at work and then the 30% you're working from home. But if you're a remote worker, then you should see this different, or you should ensure that for you to have a remote work environment that contributes to your mental health, you should have achieved the different strategies we have put here. You should have regular breaks and movements to stretch. You should have healthy eating habits. You should have eye care, addressing your eye strain with proper lighting on the screen and positioning. You should embrace the work-life balance, okay? So even people that work from home, they take leave. I hope that is very known. Then utilizing tools and resources such as mindfulness apps and meditation. So in between work, try to meditate, try to get off the desk, get off your space that you have created and stretch a little. Then engaging in team building activities. If you're working from home, how do you do team building activities? You can do with whoever you have at home, or you can identify a social connection outside your home that you can engage with after work. Then ensure clear and effective communication to reduce misunderstandings and build trust. Okay. Then flexible work arrangements, neutral lights, and air quality. So these are some of the examples for someone to say that their remote work is contributing to their mental well-being. So this is what we call remote work wellness. Okay. Then digital. Here we are defining digital wellness. I know that most of us are working in a digitalized environment where you have a desktop. Some of us, you work on 3 desktops at a go. You have a laptop, then you have a tablet, then you have a desktop. Then you have a phone. People, like you're surrounded by machines. You're surrounded by technology. You're tapping here, you're responding to on Teams here. You're everywhere using digital appliances. So digital wellness is the optimal state of health and well-being that individuals can achieve while using technology. So this one is beyond working from home. This one could be also in your work environment. At office, you find, like I've said, you're using different digital appliances or tools at a go. You're working on a laptop at home, you're working on a desktop and a laptop and a computer or a phone rather at work, among others. So for digital wellness, what we need to know about it is that it is about mindful use. You have to be mindful of how you use the digital appliances or tools if you want your mental health to be taken care of. You have to set boundaries. When am I on my laptop? At what time do I shut down my laptop? When am I on my phone? You know, as we continue discussing, you realize that in a digital environment, you have to have breaks off the appliances. You put down your phone. Not every time your phone is in your hands. You put down your phone, like they tell us that before bed, at least 2 hours before that, let your phone be far away from you. Don't look at the phone for your eyes to be okay, you know. Then by protecting your mental health and physical health, you choose what to feed your mind. You choose what to see, what not to see, what to read and what not to read. Using technology to enhance life, not to detract from it. So that is a little bit about digital wellness. Okay. Please, people, keep with me. I shouldn't leave you, and you shouldn't leave me here. We are going to heaven together. Technology, the double-edged sword. So this is contributing to the digital environment. So technology is something nice, okay? But in mental health, we are realizing that it is one of the root causes of mental issues that we are having, especially among the young population and work population, people who are engaged in work. Okay. Why is it like that? It has its benefits or the pros, but it has also its cons. Okay. So digital or working with technology these days, it reduces commute stress. Who wants to be, for you guys who are working in Kampala, wants to be in jam for 2 hours if you can work from home. So it reduces commute stress. Okay. It enhances flexibility, meaning it improves work-life balance. If you're working from home, you make your cup of coffee anytime you want. You can decide to sit on your bed and continue working. You know, you can decide to be having a conversation with your family as you're responding to the different work. Then access to information and learning. That's another beauty of technology. We have access. Okay, entertainment and convenience, then professional advancement. Most of us, you've achieved your qualifications, you've studied, you've researched using the digital technology, but then the potential drawbacks of digital technology. So keep up with me. I'm trying to help us understand the whole background of how digital technology or digitalization at workstation or at work environments contributes to our mental health. Mental health issues. This is where anxiety and depression kicks in. You know, it gets boring working alone from home. It gets exhausting. Sometimes using the digital appliances, you become addicted, okay? You turn them into your friends. These days we have AI where you have someone to talk to, you have where to get advice from. So the depression and anxiety will come in. Physical strain and techno stress. Your eyes, every time your eyes are on a screen, what we call blue light. Your sitting posture. You're either bent a little typing on the laptop or you're on your phone slanted back. So there is that physical strain that comes where we've seen people having challenges with their spinal cords or their posture. Then sleep disruptions. You find that you sleep either after midnight or you keep being interrupted by notifications because of the digital for technology or appliances we have. Social comparison or FOMO, what we call fear of missing out. For people who are on TikTok or who are on different social media platforms, you see how people are achieving on their lives. You see how they are, taking on their careers, and you feel like you're really being left behind. You start comparing yourself. You start comparing yourself with people's relationships. All this comes through because of the digital technology. Okay, or the digitalization, the access we have to digital appliances. Then always on culture, hence increased workload. Another issue is that if you're, facilitated with digital appliances and you're working from home, they expect you to be always on, or we adopt an always on culture. You find that every time they send a Teams message, whether at 11 in the night, you're in position to respond. Whether it is at lunchtime when you're having lunch with your family, you're in position to respond. So another challenge that comes with digitalization is always on culture. I choose to believe none of us is on that category. So that is a little bit of the pros and cons with digitalization. Okay. So mental health best practices in remote and digitalized work environment that we can learn a thing or two. Okay. as we continue. So while in remote and digitalized environment, we need to set rigid boundaries, okay? That is digital detox. Sometimes the way I've seen us, different people, detox our bodies by taking detox drinks and everything, even with technology and while working in a remote environment, using working from home, do digital detox. Create a clear separation between work and home. Yes, Victoria.
Thank you very much, Madam.
Mm.
Digital detox, sometimes it is hard. Yes, we're talking work, and
Yes,
some of us have businesses, and we use our phones so much to look for to see the comments of our clients. So digital detox becomes hard to make or to take place because all the time you have to be on. A client may ask for a product, or a student may need you something, and then you're not online, and then the client will say, I wanted 50 pieces of coffee, but we are not online. And you know, for me, I always use WhatsApp. So, and you're like, oh my God, I can't because yeah. So sometimes that digital becomes hard. It becomes for us to talk.
Sure.
So what solution now be there? Because most of the marketing these days is done through digital, social media, and all that. The traditional methods of marketing are no longer being used by so many people. So how would you help us on to this? Social media for their marketing? All businesses.
Okay. Thank you so much. I will not give you a solution on how else you can do your marketing. It's not being against it, but for your mental health, okay? For your mental health, you have to set clear boundaries. For example, if I know that I have my clients, but as I get these clients, I really have to set boundaries. I have to say, that's why we call them rigid boundaries, because you want to take care of your mental health. Because imagine, Victoria, it is after midnight, but you're still responding to orders and everything. Maybe if it is international where you're working in different time zones, you have clients from different, nationalities, okay? But still, they will understand and respect the fact that you're in Uganda and after midnight, Victoria is off. So I can place in my order tomorrow at 8. So it is all about you being intentional in taking care of your mental health. Because as we continue to discuss, all this, you will chase it. But if you get stressed, or if you get sad for a long time, you will get into that state we call depression. And all this that you're chasing, trying to respond to the clients and everything, you'll find that it is not making any sense. So digital detox, it is you being intentional about saying that, okay, after midnight or over the weekend on Sunday, it is me and my family. Whatever orders they are waiting up to 5 in the evening, when I'm done playing with my children, when I'm done taking care of my husband, or when I'm done doing ABCD. And it will be respected, okay? And yes, so you
Okay,
just have
thank
to
you very much.
intentionally set backgrounds. Yes. All right.
Okay, thank you.
It's not a simple journey. You start it, you learn it, you break it, but you will pick up for your case. Okay, so in that one, you shut down laptops at a specific time, you turn off email notifications, like that. That is digital detox. Then structure your day.
Okay, thank you very much.
You're most welcome, Victoria. Thank you. Another practice in remote and digitalized work environment, guys, is structure your day. Okay, I know most of us do it, but with your mental health, you have to intentionally do it. I just wanted to use that, borrow the word of this politician that has been trending, Chiambagwe. It is for you to reach a moment and you say, I'm going to maintain my constant routine. At 8, I'm at office. I'm working. At 10:30, I'm taking a 20 minutes break. I will just get off the laptop, take a walk in the compound, grab a cup of water, come back to my desk. That is after 10 minutes. Okay? So you have to schedule those breaks to avoid burnout. Okay? Keep with me. I don't want to lose you. So structure your day. Then establish social connections and schedule regular check-ins. And when I say establish social connections and schedule regular check-ins, for people working from home, you have to actively foster connections, such as calling a friend. Even when you're working from home, you can call a colleague at lunch break. You know, if I'm Victoria and I'm working with Rita, okay, I want to check in. I have to call. Just crack a joke for 2 minutes and everyone gets back to their work. You know, call a friend, talk to them, set virtual breaks like this one now, Emma, that you have put for us. Okay, if it was beyond 1 hour, I would say that after 30 minutes, or literally most of the times when it is for 2 hours and beyond, you schedule virtual breaks where like everyone, let's get in a cup of coffee, we resume in 5 minutes. And that is enough for your mental health, for you to just take a break a little. And it is good for you not to have that effect of being on the machine the whole time. Okay, and encourage cameras on in meetings to pick up on non-verbal cues. So for guys who are working with people who are working from home or who engage in a lot of virtual meetings, like the way Emma organizes, you have to encourage cameras to be on. What do we mean by picking up on non-verbal cues? Do you know that you can look at a person, you get to know Leah is going through a lot. Leah is not happy today, or Leah is overly quiet today, you know? Or you look at someone in the camera and you see that they are tearing. Okay, so those are some of the signs and symptoms that someone is going through some challenge. Someone is stressed, someone is anxious, someone is depressed, someone is traumatized. Because imagine you put on a camera for everyone has switched on their camera in a meeting and you see a colleague's eyes are red. And you're like, you get concerned as a leader or as a colleague, you're like, this guy is working from home. But you know, today in the meeting, something was off. Okay? Yeah, so that is another practice we need to pick up for our mental health. Then designate a workplace. This one, we already talked about it. For people who are working from home, you can't just say that every time you're working from your bed, you will, you know, get stressed, you'll fall back into a place. But dedicate a specific place in your home to work from so that you can physically move from one corner to another corner, that is my office. And then you can mentally say that now I'm out of my office, even if it's just a table in your bedroom. You're like, now I'm out of my office, I'm walking to the sitting room, you know? So that also helps you. Just you taking a 2-minute step away from a station to another station, that is taking care of your health.
Leah?
Yes, please.
Just
Yes,
time
please.
check. I think we have around 10 minutes to go.
Let me run through. Yes, thank you so much. Now I'm going to run out because at least the remaining signs and symptoms, we've been discussing them. So remote workers burnout, Emma will want everyone to at least pay attention to this. Remote workers burnout signs and symptoms. Difficulty disconnecting. You know, these people that are working long hours than necessary. Someone is always online, you know, the ones we say that always on culture. That is a sign and a symptom that someone is experiencing burnout. You don't want to switch off your laptop. You don't want to leave office for people in a digital space. Poor communication, decreased participation in meetings. You switch on a virtual meeting like this, but a person who has been communicating, being active, never does. Then lack of proactive communication, failing to reach out to managers to ask questions. Someone is working from home, but you never hear from them a whole week. They are not asking questions. They are not seeking support. They are not seeking feedback. You know, micromanagement anxiety regarding the level of scrutiny being placed on their work. Someone feels like they're being micromanaged when you try to follow up. Then technology fatigue, exhaustion from spending all day online. That is burnout. Okay? Yes. So let me rush through signs and symptoms that can manifest through the emotions or behaviors and the physical. Distancing and isolation. When someone is working from home, but they never respond to calls, all that, or in a digital space. Digital negative self-image, feeling unskilled, feeling I don't know, I can't put together this PowerPoint presentation or anything. Depression, resentment, that is not all related to emotional. So these are signs and symptoms that we need to watch out for as we engage with colleagues that in a hybrid setting or in a remote work environment or in a digitalized space. Okay, the behavior one, increased use of drugs, missing out work, anger and irritability, avoidance, among others. Okay, now, as I conclude, like Victoria asked, what can I do? All that you have to pick up what we call self-care. Self-care is very key. Self-care refers to activities and practices that we can engage in on a regular. So it doesn't matter whether you're working from home or you're working from office. You have to engage in regular activities and practices that can reduce stress and maintain and enhance our short and long-term health and well-being. So there is no health without mental health. That's what we say. There is no health without mental health. That's what we say in mental health. Because if your head is not okay, because the mental is have to do with the cognitive. If your head is not okay, you will not be able to run anything well. Okay? So self-care is key. Is self-care in a remote environment important? Yes. Why? The reasons are there. It provides opportunities to disconnect. It provides tools. It reminds a worker to take natural breaks, among others. Physical self-care, I believe most of us, if it was physical, would have asked us to ask each other what they do physically to take care of themselves. They eat regularly, they eat healthy, they exercise, they practice deep breathing. Guys, I want to encourage you to adopt the deep breathing exercise. Next time we have an opportunity, we'll be able to practice. You can tell me how you do it, and we can learn from each other, or we teach us the professional way of doing deep breathing. Take time to be with your loved ones, wear clothes that you like. Even when you're working from home, people wake up, take a shower, and get into that space that we've said you've created in your room as a workspace. So you can't just remain in your pajamas the whole day, that just because you're working from home. Okay? Psychological self-care, make time away from phones, make time to self-reflect, note your inner experience, celebrate small wins, write a journal, read literature, note stressors and apply health coping skills, be curious, try new things, among others. Okay? Then emotional, spend time with others, stay in contact, set boundaries, guys. Set boundaries, because most of the times we get irritated and offended because we did not create clear boundaries. And when someone crosses, it affects us, it stresses us, we become depressed, yet we did not set clear boundaries. So even when you're working from home, please set clear boundaries. Relationship self-care, schedule regular dates, schedule regular activities, make time with see friends, call in on your loved ones, among others. Workplace self-care, take a break during work day, take time to chat with co-workers, even online, set limits with clients and colleagues, Victoria, balance your caseloads, okay, arrange work, among others, okay? Now, finally, Emma, this is my last slide. I'm saying, all in all, for someone to balance to enjoy their mental health in a remote and digitalized work environment, you have to develop a self-care plan. The picture on the side says you cannot pour from an empty cup. So you need to take care of yourself first, okay? So self-care for remote workers is not a luxury. It is a necessity for maintaining a healthy and productive work-life balance. Okay? Thank you so much for listening to me. Emma, I hand back to you. If there are any questions in the chat, they are most welcome. And colleagues on call, thank you for engaging me in this. I've learned a lot from each and every one of you. Bye-bye. Over to you, Emma.
Thank you.
Emma, I think someone needs to mute. Victoria.
Okay, thank you very much. Yes, Leah? Leah? Leah?
Can you hear me? Sorry, I was talking to myself. Yes, Emma, thank you so much. I've concluded and I've left it for you to let me know if there are any questions in the chat room. Any other questions that colleagues
Yeah, I
might
was just
have.
asking if some members have questions now. We can have some questions, 2-3 questions before we can conclude this session. Members, do you have some questions for our presenter today? If you have a question, please just unmute and
I think Asharaf IT needs to mute.
I think that is sorted. I was just asking members, do you have any questions for our presenter?
Yes, thank you.
Yes, please.
Thank you, Leah, for a great presentation. So some cultures, it's interesting that we talk about intercultural doing this program, but some cultures will download, mental health, right? What advice would you give for that? Or not even some cultures, maybe sometimes even for men, for example, right? Men are told to be, strong, or men don't cry. And then certain cultures in Africa too will be like, oh, you have to be strong. What tips would you give for that, for managing that?
Okay, thank you so much for that question about what advice would I give for where cultures are rigid about discussing on anything related to mental health. So one thing in mental health you have to do is to understand people's Ashraf, you're unmuted. Yes, understand people's cultures. Mental health, you're introducing it, bearing in mind the context of every place you're in. So you have to first understand from the people. When someone is experiencing the different signs and symptoms and everything, how do they usually help them? So you get from their own perspective for someone to be helped to overcome those stressors, okay, or to overcome what is challenging them. What do they do? Okay, so once you have understood what they do, you get to hear from them. Now, what can they do in that same setting to help a person experiencing such? So when it comes to anything to do with culture, you have to be sensitive about it and approach it from their own perspective, bearing in mind that most of the times most cultures don't welcome mental health sessions and interventions is because of the stigma that comes with someone being tagged as someone with a mental challenge. So that stigma, the fear of being stigmatized, is what prevents them from seeking support. They assume that if I'm going through all this as a man, I shouldn't talk about it. But the moment you get to explain its side effects, they get to understand. So the advice I would give to someone who is restrained by their cultural beliefs to seek support for their mental health is to explain to them the benefits of seeking that support, and then to understand what strategies they would put in place themselves to help someone with such a challenge. So yes, that is so far how it would help someone with restrictions because of their cultural practices or their cultural thinking and their cultural understanding of mental health, by you making them understand that it is from their own understanding that they can get the solutions, and it is for their own good that they get the solutions to address that. And mental health is for everyone. It does not discriminate whether you're a man or a boy. Everyone can feel isolated. Everyone can feel overwhelmed by the different responsibilities, and the only way to engage them is for you to show them the benefits of taking on the strategies that are in place to address such a challenge. Thank you.
Thank you so much for that, Leah. And I think one other important thing that you said, as far as putting, rigid time limits on the time being on phone, because as Victoria stated, that we work on our phones, right? We do a lot of stuff, we're communicating. So that line, the line between working and socializing on the different apps on the phone can become blurry. So I like that you said you have to be intentional and put a rigid limit. Like, okay, now is the time to put the phone away, or even to put the laptop away and step away from that. I needed to hear that advice.
Sure. Thank
Yeah,
you.
thank you very much. I think that is good. I think members, I don't know if there's any other question or any other compliment, but I think this has been a very good session. Leah, we can't thank you a lot. We can't thank you much. Thank you very much. I really feel like I should get another session for you, to give us more and more and more. Others, thank you very much. And thank you all the guests. Thank you all the members who joined us today. Please join us again when we have a session like this. Thank you very much.
Thank you so much. Thank you for the opportunity. Have a good evening, everyone.
Thank you.
All right.
Good evening. Thank you, the hosts. Thank you for organizing this. It has been very fruitful.
Thank you very much. Yes, please.